Welcome to our training. Today's training is on individual risk assessments for children with SEND in early years. It's written and delivered by the Early Years Inclusion team. The aims of the training is for you to gain an awareness of the setting's legal requirements for supporting children with complex needs, to gain an awareness of the difference between a hazard and a risk, and to have an increased confidence to complete risk assessments, and to have knowledge of the recommended SEND healthcare risk assessment paperwork. There's a six-step programme to consider prior to complex children starting: your policies and your admissions process, your partnership with parents, so that parents are part of the process when you're writing the risk assessment, team around the child meetings, so that could be setting up a TAC meeting so that parents are present when you're writing the risk assessment, and the risk assessments and healthcare plans need to be in place prior to the child starting. And looking at your training insurance, it's really important that if you've got a complex child attending your setting, that your insurance is robust enough and you've got the right level of training for the staff supporting, and making sure that the funding is in place to support that child and you have staff to support them when they are attending. Policies and admissions. The Code of Practice states that you must make reasonable adjustments and you must promote equality and of opportunity for disabled children. So, a risk assessment sets out reasonable adjustments that you are going to take in order to include the child and keep them safe. And we always advise that you can stagger admission for some children to ensure a positive and well-planned entry into your setting. But this should always be reflected within your policy. Risk assessments. Risk assessments should be carried out across all aspects of your provision, and the inclusion team recommend that any child who has a healthcare plan in place should also have an accompanying risk assessment. Both documents should be updated regularly to demonstrate the steps that practitioners are making to meet the needs of the child and to keep them safe from harm. It is important to risk assess the individual child with complex needs, as it is to assess a room or activity. This is the paperwork for a risk assessment, and on it are some pertinent questions to help you complete it. So, why do you need a risk assessment for individual children? So, mainstream childcare settings are increasingly providing care for children with additional needs. So, it's really important that you can adapt your activities to include them. So, risk cannot be removed completely, but it is possible to manage them appropriately, and you must ensure that the children are not exposed to any unacceptable risk. Does every child need an individual risk assessment? No, only children who are at risk of harm due to the child's individual additional and/or needs. You will do group risk assessments for all children on certain activities, but the ones that you fill in individually are for their specific needs. Does the child have a healthcare plan in place? Yeah, if yes, they do, then it's really important that they have a risk assessment alongside that plan. What do you include in the individual risk assessment? So this is, you only include activities or actions that impact on that particular child. So it's individual to them. If they don't impact on an individual child, don't include them. Do I need to risk assess children who display challenging behaviour? You do not need to assess the individual child, but you would probably have a group risk assessment for challenging behaviour that will be part of your policies procedure. And who should carry out the risk assessment? The individual actions and measures should be discussed in partnership with, again, that really important parent and carers, the key person and the schools, the setting SENCO. And the whole staff team should be aware of and fully include the statements that you write down, so that that child is included and that they are aware of the risks to individual harm. So, what is the difference between a hazard and a risk? A hazard is something that can cause harm, So, for example, a substance, a piece of equipment, or a work procedure, or in the childcare sector, a child's condition. And a risk is the chance of high or low that any hazard will actually cause somebody some harm. Here are some examples of hazards and how to minimise the risk. So, for example, these are very specific to an early years setting. So, putting small objects in their mouth, you would consider which resources you have out in the environment, and you may need to reassess which ones are out. That's going to need a high level of supervision, providing safe objects to chew if sensory needs are required. So if they've got no sense of danger, you would secure the buildings and reassess it. Again, high level of supervision, consistent strategies for staff, an emergency plan in place if a child does escape. Put too much food in their mouth. It's quite a common one for SEN in early years. So you would have a high supervision at lunchtime or snack times. You would limit the food on the plate, cut it up into bite-sized pieces. This would all depend on the need of the child, and obviously clear communication methods if they're being supported by hearing impaired or visually impaired. Head banging, again, have a cushion available to place under the head when banging to stop harming, and do your ABC to identify triggers and to distract, again, high supervision. Biting should be included within the positive behaviour plan, and the risks to minimise this, you would look at ABC, look at your transitions, triggers, sensory needs. It might be that they've got a sensory need that needs meeting, and again, it would be high supervision. Climbing onto furniture, high supervision again because it's unsafe. So you would need appropriate equipment, a consistent approach by all staff and for all children. Non-mobile children in preschool rooms. So again, this is quite common with children with physical disabilities. So you would need to make sure that you've got clear pathways between activities and escape routes, manual handling policies for all the staff, emergency procedures for a fire, story time, circle time, for all the children to understand the vulnerability of the child. You review your environment to allow ease of access, and access specialist services such as PD outreach. This is a risk assessment form. So all the information we've just talked about, this is what you would enter it onto. So the risk assessment details the potential risk of harm, and also it would look at the hazards as well. And it's fairly straightforward. You put the child's name, date of birth, setting, and what is the hazard, who might be at risk, how do you minimise it. So all the information is there. So all the things we discussed earlier would be easy to add to that form. And as if by magic, there is the completed form with the risks that we mentioned earlier. So obviously the putting things in their mouth, too much food, head banging, so that's in the hazard. Who might be at risk? It's always the child that is at risk. Sometimes for some physical behaviour, it could be child and adult, or the children. What do you do to minimise the risk? So there you would put all your strategies in place. What, if any, further action is required? So it could be, that you need to check the environment, access other things, the action and by whom. So it would be all staff are aware of the risk in place, and they would obviously carry it out as well as the key person. And then you'd put when it's going to be actioned by and when it's been completed by. There is inclusion supplement funding available. So depending on the need of the child, you can apply for inclusion funding to support them. This can be used for increasing staff ratios at high times of risk, training in SEND, and resources specific to the child. And this is our useful links page. So as I said earlier, all the paperwork that we've chatted about today can be found on our A to Z of resources, and those are the links below. So we've got a risk assessment template, We've got a guidance on completing risk assessments in more detail. There is also some more detailed training that will be available if you'd like to access that as a whole setting. And then there's an example risk assessment which has been created to aid you as practitioners in completing a risk assessment. And these documents should be created for any child who has a healthcare plan in place, don't forget. Any further questions that I haven't touched on today, please phone our early years team helpline on 01905 843 099 or contact us on our early years inclusion email, which is there, and one of the team will get back to you and we'll support you as best we can. And our web page is there, and on that is every little bit of information you need to know about inclusion. There's the A to Z of resources. There is the link to all our different webcasts. This is not the only webcast. We've got lots of little bite-sized ones. And if it's something that you're interested in, you think we haven't touched on in enough detail, there are some more in-depth training that's available for settings if you'd like to purchase it. Thank you for listening to our webcast. Bye.